My name is Shamika Krejcian Bass. As earlier mentioned, I serve as the Senior Manager of State and Primary Care Systems for the areas of Louisiana, Alabama, Mississippi, and Arkansas. And so my primary role with the American Cancer Society is basically just to work with practice facilitation, oversee the direction within the clinics, just to make sure that all of our accounts are very familiar with the delivery of services that we have to offer at ACS, which a lot of times can equal added value to your accounts by helping to increase screening rates for cervical, breast, lung, colon, you name it. So we're happy to be here with you this morning. Thank you, Apka, for allowing us to have this opportunity. Kimberly, I'll pass it to you.
Good morning, everyone. This is Kimberly Williams, and I'm the Health Systems Manager for State and Primary Care Systems for the state of Alabama. I am hoping that I have met most of you, if not all of you, that are joining us today. I have been with the American Cancer Society. It'll be 22 years this December, and I am just very thankful to be a part of this organization, which continues to help save lives in the fight against cancer. So thank you so much for joining us this morning. You'll want to go ahead and advance to the next slide. Shamika, I think you have control. This is a quick overview of what we'll be talking about today. We know that most of you are very familiar with cervical cancer, and there might be some new staffers on, and so we are just going to be taking a look at how common cervical cancer is, what is cervical cancer, what causes it, what are the risk factors, can cervical cancer be prevented, test to find cervical cancer early, and what you can do, as well as more information. This is a short, quick call, so we'll be going through all of this information fairly quickly, but hopefully you'll walk away feeling like it was a well worth your time. So cervical cancer, how common is it? Nearly 13,000 new cases in women in the U.S. each year, and there is about 4,000 deaths in women every year from cervical cancer. Over the last 40 years, the cervical cancer death rate has gone down, though, by more than 50%, and the main reason for this change is the increased use of the Pap test.
All right, so what is cervical cancer? So doctors use several different terms to describe these precancerous changes, including cervical intraepithelial neoplasia, CIN, or squamous intraepithelial lesions, or dysplasia. And you'll see here that we have a pretty little picture to kind of depict what that looks like. So as far as what is the actual growth, we see that there's growth of abnormal cells. The cells can invade and damage normal tissues. A lot of times they do start in the lining of the cervix, and the cells don't, usually typically suddenly change it to cancer. Instead, it's a progression that gradually comes as there's precancerous changes that may lead or turn into cancer. So this picture just kind of shares a little bit of the histology and just kind of lets you have a closer look at some of those epitheliums, junctions, and the normal cervix line, and what that actually looks like for those. So HPV can be passed from one person to another during skin-to-skin contact, and one way HPV is spread is through sex, including vaginal, anal, or oral sex. HPV is a group of more than 150 related viruses, some of which cause a type of growth called papillomas, which are more commonly known as warts. Doctors believe that a woman must be infected with HPV in order to develop cervical cancer. And so although this can mean infection with any of the high risk types, about 2/3 of all cervical cancers are caused by HPV 16 and 18. Kimberly, you want to share about the risk factors?
So sorry, I had put it on mute. There are different types of cancer risk factors in regards to cervical cancer and in regards to cancer. Different cancers have different risk factors. For example, of course, exposing skin to strong sunlight is the risk for skin cancer. And smoking, of course, is a risk factor for lung cancer and many other kinds of cancer. But risk factors don't tell us everything. Having a risk factor or even several risk factors does not mean that you will get the disease. And some people who get the disease may not have known they even have risk factors. Even if a person has cervical cancer or is with cervical cancer as a risk factor, it's often very hard to know. So, of course, screening is imperative. It's very, very important that we have screening. Still, researchers have found several risk factors that may increase with a woman's chance of developing cervical cancer. And as Shamika mentioned, cervical cancer, one of the major risk factors is HPV. It is extremely common in women who have had sex. However, it can be treated. It cannot be treated, excuse me, but it can be prevented. HPV is very, very important to ensure prevention of cervical cancer. And it can also treat warts. Having HPV infection does not mean that you will get cervical cancer. In most cases, HPV will clear on its own. Only women with persistent HPV, where the virus does not go away, are at risk for cervical cancer. And continuing with cervical cancer risk factors, not getting screened, this is the main risk factor. And oftentimes women will think that they've had a pap smear, but they indeed have not had a pap smear. And so it's very, very important that providers are talking to them about cervical cancer. Smoking, women who smoke are twice as likely as non-smokers to get cervical cancer. So when a patient comes into the clinic, it's very important to have that conversation with them as well, to ask them if they're a smoker and to ensure that they understand that there are programs in place to help them to quit. Weak immune system is also a risk factor, and due to HIV and due to drugs that can suppress the immune system, it's very, very important to have all of these conversations with patients to ensure what their risk factors are, to ensure that they understand that they are at risk of getting cervical cancer. Screening is the test to find cancer, as we've mentioned, and other diseases. And it is, of course, screening is often a prevention measure, and it's very important to ensure that people are getting screened. Screening can help find cancers when they're small and they have not spread. And as we know with pap smear, people will oftentimes not even know that they have the disease until they have the screening done. So it is imperative for them to get a pap smear taken. I'm so sorry. I don't know why I keep going in and out. When they have a better chance of being cured. Screening can also find precancerous changes that can be treated to prevent cancer from developing.
That's right. And so talking about screening, there's a couple different tests that are highly recommended. And so you'll see here a couple of those tests, and we're starting off with the pap smear. So abnormal cells found in pap tests are really treated before they become cancerous. Pelvic exams are not a proper testing method. When cancer is detected early, of course, it is much easier to treat. There's also the HPV testing. So the results for these can help the providers decide if more testing is needed. And a lot of times, this is done together with HPV testing, of course, and the pap testing, also known as co-testing. So why is co-testing preferred? Generally, there's been several large studies that show that there have been greater benefits and reduced harms of co-testing for HPV and the pap test at longer screening intervals. So very important, and many times when HPV is found, there's an automatic recommendation of doing both of those tests together. So what are some of the American Cancer Society guidelines for cervical cancer screening? So many of you we know use different types of screening guidelines, and so we'll share a little bit of those in a second. But for those of you who are familiar and who use the ACS screening guidelines, you'll know that a few years back we did a lot of extensive research to really help us develop and define what our new screening guidelines would be. And that is that women under age 21 should not be screened. And we really focus on women ages 21 to 29. And so we do PAP tests for those individuals every 3 years. And HPV testing should not be used unless needed as a follow-up after an abnormal PAP test result. Starting at age 30, we focus on PAP tests with an HPV test every 5 years. So that's when that co-testing comes in until about the age of 65. And so another option, of course, is just that PAP test that's done every 3 years until the age of 65. So some women believe that they can stop cervical cancer once they have stopped having children, but this is not correct. So women of ages 66 and older must have 3 or more consecutive negative PAP tests or 2 or more consecutive negative HPV and PAP tests within the past 10 years. So the most recent testing should have occurred within the past 5 years. And so they should stop cervical cancer screening after that time. As a side note, serious precancers, including the CIN2 or CIN3, which is that cervical intraepithelial neoplasia. Women with the history of those things should continue to have testing for at least 20 years after the abnormality was found. So here's a few more, and it talks about, how do we look at women with hysterectomies? And so when we talk about hysterectomy, that's hysterectomy without the removal of the cervix, or otherwise called as that supracervical hysterectomy. And so women who have had that total hysterectomy should stop screening unless that has been done as a treatment of the cervical precancer or cancer. And other women who have these hysterectomies without removal of the cervix should continue cervical cancer screening according to guidelines. Alrighty, and so frequently, or yearly or every 2 years, cervical cancer leads to more harms than benefits, but women who have had abnormal screening results may need to have a follow-up PAP test done in about 6 months or a year. Women who are at high risk of cervical cancer because of history of cervical cancer or a suppressed immune system. So for example, as we mentioned earlier, a woman who has had an HIV infection or organ transplant or long-term steroid use, or because they were exposed to the VES in the utero, may need to be screened more often. They should follow the recommendations of their healthcare teams. So this screen, we talked about, of course, we have the ACS guidelines, and we also have the United States Preventative Task Force guidelines as well. And then we also have the American College of Obstetricians and Gynecologists recommendations. So this is pretty much all of those in a glance. You get to see the breakdown for ages and what the recommendations are for each of these methods. And so the one that I'll call out more specifically, I know many of the FQHCs and community health-based centers actually follow that U.S. Preventative Task Force guidelines. So dive into those a little bit deeper. So of course, for this one, you can see that they're very similar for those ages of 21 to 29 with all three. They all pretty much follow the same guidelines. For 30 to 65. The difference here is with the United States Preventative Task Force, they actually also would prefer to have PAP alone every 3 years, co-testing every 5 years, HPV alone every 5 years. They all recommend to start at age 21. And as far as screening among fully vaccinated, it's the same as for non-vaccinated. But where we also see a little bit of the differences for those with the hysterectomy. And so they do recommend against screening for cervical cancer in women who've had a hysterectomy with the removal of the cervix and do not have a history of high-grade precancerous lesions. So for example, that CIN grade 2 or 3, as we earlier mentioned, in cervical cancer. Women older than 65, they do recommend against cervical cancer screening in women older than that age who have had adequate prior screening and are not otherwise at high risk for cervical cancer. So you can see, although it's a very, very slight differences in the recommendations, generally the guidelines are very, very similar between the three organizations. So what can you do to beat cervical cancer and prevent it? Kimberly will share a little bit more about that.
So what can you do to prevent and beat cervical cancer? Of course, avoiding being exposed to HPV is the first step, and certain types of sexual behavior increase a woman's risk of getting genital HPV infection. And so if an individual, of course, will wait until they're older to have sex, of course, that will help them avoid to get HPV. Also, it helps to limit your number of sexual partners and to avoid having sex with someone who has had other sexual partners. And although the virus is most often spread between a man and a woman, HPV and cervical cancer are seen in women who have only had sex with other women as well. And of course, condoms is a good way to provide some protection against HPV. However, condoms cannot protect completely, so that is one reason why it says can provide some. Of course, don't smoke, and of course, get vaccinated with the HPV vaccine. Cervical cancer screening recommendations and guidelines can be complicated, and of course, what is so important is y'all's role. They will often do what a provider recommends, and so it is very important within the clinic that we are not missing opportunities to get people screened for cervical cancer. We need to ensure when they come in that they are being asked if they've had the pap smear, and also if they have had HPV vaccination, and also if they've been screened for HPV. So it's really important to be having these conversations with your patients in all different levels, and ensuring that they know all the options that are available to them based on their age and their risk and their preferences. Shamika, I'm so sorry, but there continues to be a major sound on my end of my phone, and it's really interfering with me. I don't know if y'all can hear it, but I feel like I need to pitch it back to you if you don't mind, because I'm really having trouble concentrating. I'm so sorry, but it's
no
like buzzing
worries.
and beeping. I'm sorry.
No
so
worries.
If I can pitch
really
it back
but
to
I'm
you.
happy to
Okay,
pick it
thank
up.
you.
So we should
Thank you.
You're welcome. We should use all available tools to prevent cervical cancer. And so although we know that cervical cancer has decreased in the US in the past century due to screening, and we also recognize that significant disparities still remain. There has been an evolution in technology that's really helped out with many things, and there's been updated screening recommendations and guidelines, but those can also still be very complicated. As you saw, we had three different guidelines that were set apart, and many people still have questions as to, how those guidelines have come into practice. And so we want to continue to be a great advocate to be able to share some of those things and talk through those questions. But one thing that we do know is that we know that HPV vaccination does hold promise to decreasing the burden further. So what can you do? So we all know that HPV vaccines, again, are safe and effective. They do prevent cancer. This is one of the first times that we've been able to say that we have found a vaccine that helps cure cancer, and it is certainly very much true. We like to make sure that when we message and when we talk about HPV vaccination and the vaccine for girls and boys, that we don't, share that in a sentiment of it being within a sexual nature. This is a cancer vaccination, and so we're very excited to be able to share that with individuals so that they can hopefully not have to hear those words that many survivors from cervical cancer and other types of cancer have heard, to hear those painstaking words of them having cancer. So one of the HPV vaccines have been proven to protect against anal, vulvar, and vaginal cancers, and they can also be, that also can be caused by HPV. And so there are also some penile and some head and neck cancers that have been associated with HPV as well. We say here, 11 and 12, but we really do encourage you guys to even think about it a little earlier than that. Start to get them in at the age of 9 and 10, where the conversations, can be a little bit easier, and they're already going in for other vaccines, and so it can make that information easier. We also do recommend the sandwich method. So we know there's other vaccinations like the Tdap, meninge that's going to be offered. So stick that right in the middle to kind of help to increase certainty of parents and actually wanting to go ahead and get that. But we do know that there's some great protection amongst many cancers that we're starting to find that has been linked to HPV infection. It is something that is covered by insurance as well, and about 60% of girls and boys are starting to get those vaccine series nationwide. And it's very important that they do finish that series completion so that they can be equipped and ready to handle anything that will come their way. So why don't parents get their kids vaccinated against HPV? So there's a lot of different things, and I'm sure as you guys work within your clinics that you start to understand those things. And I think the biggest thing that comes into play with this is just a lack of understanding and just having everybody on board. From the front desk to the highest provider, everybody needs to be on board with actually disseminating this vaccination. We need to have them understand, if there are any safety concerns, let's talk through those. Let's really be advocates for what this is about, and that's to help them for them to not actually have to get any types of cancer. It's very important that, by that provider and physician recommendation, that this be given out as well. We know a lot of times patients will do things because of the recommendation provider. So it's really, really important to have everybody on board and that everybody is also really educated. There are tons of information out there to help you get more educated if you feel like that's the area that you need. Kimberly and I can certainly be a resource for that. American Cancer Society has a lot of great tools and resources, but the CDC also is a great place to find information as well. So what can you do? First and foremost, routine screening offers the best way to find cervical precancers, which can be treated to keep cervical cancers from developing. It's also the best way to find cervical cancer early, when it's small and it has not spread. Finding cancer early gives you a better chance for successful treatment, and most invasive cancers are found in women who have not had the regular Pap test. More information. So just talked about a little second ago about where you could find more information. Our American Cancer Society website, which is placed here at www.cancer.org. We also have a 1-800 number. What's really unique and special about this 1-800 number is that it not only is available to you all as healthcare providers, but it's also open and available to anybody seeking information, whether there is, current cancer patients, those who just want more information. But what's really unique about us is we are available 24 hours a day, 365, and we can navigate patients to resources as well as you all. If you want talking points or speaking points and presentations of different cancer areas, we are more than happy and equipped to be able to help you with that through our cancer information specialist. But of course, again, Kimberly Williams is your Alabama advocate, and she certainly can help you guys if you're more interested in having direct cervical cancer presentations be offered at your facilities. Certainly can help you with that, as well as, things that can help you drive your screen rates. So if you're not familiar with her, you would see her information back on the slides that you guys have presented on slide 2 to find her direct email address and how you can get in touch with her. So again, we just want to say thank you, and not only thank you for you guys just taking some time out to be on the phone to listen to this presentation, which we know could be somewhat repetitive since it's the 101, but we promise it'll be the flames will spark a little bit more in the coming presentations. But we just want to say thank you. Thank you so much for standing on the front lines. Thank you for being advocates for healthcare. Thank you for being willing to really drive improvement in screening rates. One of the things that we always like to really emphasize with American Cancer Society is that, when we talk about screening rates and improving screening rates, those screening rates actually equate to lives being saved. And so, no number is too small for percentage increases, because that could be a vast majority of patients. And so very excited to be able to give and to offer any types of assistance that we can to help you do that. But thank you for everything you're doing here through COVID-19, being on the front lines and really supporting your patients at this time in communities. So here's the list of those upcoming webinars that we have. So here's the full calendar schedule that we'll have for this series. We will be kicking off on April 28th, same time, same place. We'll love to see you back here. Motivational interviewing in cervical cancer, and giving you some great tips and tricks that you could use at your facility once things get fully back up and running, on how you can actually work with your patients to make sure that they're completing their cervical cancer screening. So that's it. That's all we have for you today. We really appreciate you once again for being on and joining us for the start of this series, and we hope to see you for many more of these webinars.
Thank you so much, Shamika and Kimberly. Are there any questions from our participants?
Hello.
Hi.
This is Carlette.
Hey, Carlette, go ahead with your question.
No, I don't have a question. I'm sorry.
Oh, that's okay.
Well, Carla, thank you for announcing your beautiful self.
Does anyone else have any questions? Okay, well, as Shamika said, we will have the next webinar on Tuesday, April 28th, again at 10. And I will send you out the information to sign in closer to time. It'll be on GoToMeeting as well. And as Kimberly said, we will share these slides with you all. And if you have any other questions, let me know and I can pass it along to Shamika or Kimberly. Thank you both so much for your time today.
Thank you. We look forward to the next webinar.
Thank you.